There is a quiet terror that no one talks about, a moment that seems ordinary at first, a sudden discomfort that comes and goes so easily that most people dismiss it, laugh it off, or assume it is nothing serious. And yet this seemingly simple upset can hide something far more alarming beneath the surface, because diarrhea is not just an inconvenience. It is a signal that your body is struggling in ways you might not see, a warning that the delicate balance within your digestive system is being disrupted, and that even the most routine meal, the most ordinary day, can suddenly spiral into something that feels out of control, leaving you weak, dehydrated, and uncertain, unsure if this is just a passing moment or the beginning of a deeper problem. Because the truth is, diarrhea can strike anyone at any time, quietly, relentlessly, and without warning, transforming a normal day into one of discomfort, urgency, and anxiety. And the danger lies not just in the frequency of trips to the bathroom, but in the unseen toll it takes on your body, silently draining fluids, electrolytes, and energy, leaving you vulnerable to complications that most people never think about until it is too late. And that is the subtle, frightening power of this condition, a force that reminds you that the body, even when it seems normal and strong, can be disrupted in ways that are invisible, insidious, and sudden. And it asks you to pay attention, to notice the little signals, the moments when your stomach feels off, your energy feels lower, or when simple things like a meal, a glass of water, or a routine day suddenly feel different, heavier, or uncertain, because these are the moments where your intuition and attention can make a difference, where awareness can save you from much worse. Yet most people ignore them, thinking it is just a passing inconvenience, only to find that neglect can allow what seems small to grow into a serious struggle, something that can affect your health, your strength, your daily life, and your ability to simply move through the world without fear or discomfort. And that is why understanding diarrhea is so urgent, because it is deceptively common, almost invisible in its early stages, yet capable of undermining the body in profound ways, affecting hydration, energy, and overall function, often faster than anyone realizes. And while it may seem harmless, it carries a silent, powerful warning that your body is asking to be heard, asking for attention, asking you to act before something as simple as a routine day turns into a battle for strength, stability, and normalcy. And as you listen to these words, I want you to feel that urgency, to understand that even the most ordinary bodily upset is not always ordinary at all. That diarrhea is not just an inconvenience, it is a signal, a caution, a reminder that the body is fragile, and that awareness, attentiveness, and timely action are the keys to staying safe, strong, and in control of your health. Because the moment you ignore the signs, the moment you dismiss the signals, the consequences can be swifter, harsher, and far more serious than anyone ever expects. And that is why this is a story worth listening to, a warning worth taking seriously, a conversation about your health, your body, and your life. Because what begins as a simple upset can quietly escalate into something that demands attention, vigilance, and care. When we talk about diarrhea as a disease, it's important to understand that it is far more than just a simple upset stomach or a minor inconvenience. At its core, diarrhea is a condition where your digestive system is not functioning as it should, causing frequent, loose, or watery bowel movements. This might sound ordinary or even harmless at first, but in reality, it is a signal that your body is struggling to maintain balance, a warning from your gut that something is disrupting its normal rhythm. The digestive system is responsible not just for breaking down food, but for absorbing essential nutrients and maintaining your body's hydration, energy, and electrolyte balance. And when diarrhea occurs, all of these functions can be compromised, often silently at first. For many people, it starts with a sudden urge, a feeling of discomfort, and perhaps some abdominal cramping, and it might come and go, making it easy to dismiss as a temporary problem. Yet this seemingly ordinary experience is actually your body communicating that something is off, that the balance of bacteria, fluids, and enzymes in your intestines has been disturbed, whether by an infection, food sensitivity, or another underlying cause. When diarrhea persists, it can affect your strength, leaving you feeling drained, lightheaded, or weak, even if you thought it was just a passing inconvenience. It can also create a ripple effect on your daily life, making simple tasks, work, or travel feel challenging because you are constantly aware of your body's urgent needs. In some cases, diarrhea may become severe enough to cause dehydration, a dangerous state where your body loses fluids and essential salts faster than it can replenish them. And this is especially concerning for young children, the elderly, or anyone with weakened immunity. Understanding diarrhea as a disease also means recognizing that it has stages, a beginning where your gut feels unsettled, a peak where symptoms can be frequent and disruptive, and a recovery period where your body is working to regain normal function. During all of this, your digestive system is not just processing food, but also signaling to your immune system, showing how the body fights off pathogens, adjusts to changes, and attempts to restore balance. Even if the cause is temporary, like a minor infection or a dietary mistake, the disease itself is serious because it tests your body's ability to cope and recover. That is why medical professionals pay attention to frequency, consistency, duration, and associated symptoms when evaluating diarrhea. It is more than just stool consistency. It is a reflection of your internal health and resilience. Thinking of diarrhea in this way helps shift the perspective from just an upset stomach to understanding it as a condition that demands awareness, care, and timely attention. It reminds you that your body communicates in ways that are often subtle at first, but if ignored, can lead to bigger challenges. Even when it seems minor, recognizing it as a disease encourages us to listen, observe, and respond appropriately, because small actions at the right time, like staying hydrated, monitoring symptoms, and seeking guidance, can make a profound difference in your health and recovery. Your body is sending messages for a reason, and paying attention to them is not just wise. It is caring for yourself in the most basic, essential way. When we discuss the causes of diarrhea, it is important to understand that this condition can arise from a wide range of factors, some very common and some more serious, and each of them tells a story about how your body is reacting to stress, infection, or imbalance. One of the most frequent causes is an infection, often bacterial, viral, or sometimes parasitic, which irritates the digestive system and disrupts normal absorption of water and nutrients, leading to frequent loose stools. These infections can come from contaminated food or water, from undercooked meals, or even from contact with surfaces or hands that carry harmful germs. Another very common cause is a reaction to something you have eaten, which could include food intolerances, such as lactose intolerance, where the body cannot properly digest certain components, causing irritation and excess fluid in the intestines. Sometimes it is triggered by sudden changes in diet or eating food that your stomach is not used to, creating temporary disruption in digestion. Certain medications, especially antibiotics, can also upset the delicate balance of bacteria in the gut, wiping out helpful microbes and allowing harmful organisms to multiply, which leads to diarrhea as your body attempts to expel them. Chronic conditions, like irritable bowel syndrome or inflammatory bowel disease, can cause recurring diarrhea, often triggered by stress, hormonal changes, or particular foods, and these conditions require careful monitoring because they reflect an ongoing imbalance in the gut. Even seemingly minor factors, like travel to a new environment, exposure to different bacteria, or changes in routine, can trigger what is sometimes called traveler's diarrhea, reminding us that our digestive system is sensitive and reactive to the world around us. In children and elderly adults, diarrhea can appear more quickly and be more severe, sometimes starting with a small dietary change or a mild infection, and escalating rapidly if fluids are not replaced, which highlights the importance of paying attention to early signs. Hydration levels, stress, and overall immune health also play a role. When your body is weakened, it is less able to fight off infections or recover from irritants, making diarrhea more likely to occur. Even psychological stress or anxiety can affect gut function, showing how closely your mind and digestive system are connected. It is also important to recognize that sometimes diarrhea is the body's natural response to expel harmful substances quickly, a protective mechanism that, while uncomfortable, is a sign that your body is trying to maintain balance. Understanding these causes helps you see that diarrhea is not random or meaningless. It is your body signaling that something is off, whether it is an infection, a food reaction, a medication side effect, or a chronic condition. Being aware of these possibilities allows you to take timely action, whether that means adjusting your diet, seeking medical advice, or monitoring hydration and rest. By paying attention to what triggers your digestive system, you can better protect yourself and respond with care. Remember, every cause has a reason, and understanding it can help you act wisely and keep your body safe, strong, and balanced, because taking early steps today can prevent a simple upset from turning into a more serious health concern. When we talk about the symptoms of diarrhea, it's important to understand that they can vary widely in intensity, frequency, and the way they affect your daily life, but each symptom is a clear signal from your body that something is out of balance. The most obvious symptom is the frequent passage of loose or watery stools, which can occur multiple times in a single day and sometimes come on suddenly, catching you off guard and disrupting your routine. Alongside this, many people experience abdominal cramping or sharp pains, a sensation of gurgling and bloating in the stomach, and an urgent need to use the bathroom that can make even simple activities stressful or unpredictable. Nausea is also common, a feeling that your stomach is unsettled, sometimes accompanied by a loss of appetite or a sense of fullness that is uncomfortable and persistent. Some patients notice that their energy levels drop quickly, feeling weak or fatigued, even after resting, because diarrhea causes the body to lose fluids, salts, and essential nutrients that are normally absorbed in the digestive tract. In more severe cases, dehydration can develop, with signs such as dry mouth, dizziness, dark-colored urine, or lightheadedness when standing, and this can escalate rapidly, especially in young children, the elderly, or anyone whose immune system is already compromised. Fever can accompany diarrhea if the cause is an infection, adding to the sense of illness and making the body feel heavy and achy, while chills, sweating, or a general sense of malaise can further impact daily life. Some people notice mucus or traces of blood in their stool, which can be alarming and is often a sign that medical attention is necessary, signaling inflammation or more serious irritation within the intestines. Beyond the physical symptoms, there is also the emotional impact. Anxiety about sudden urges, stress about being away from home, embarrassment in social or work situations, and the frustration of feeling limited in what you can eat or do. Often, symptoms come and go, improving for a few hours or a day and then returning, which can create uncertainty and make planning your day challenging. Paying attention to these signals is critical because early recognition allows for timely intervention, whether through hydration, dietary adjustments, or seeking medical care to address underlying causes. Even mild symptoms should not be ignored if they persist, because what seems minor at first can sometimes indicate an underlying condition that requires attention. Understanding the full range of symptoms helps you approach diarrhea not just as a momentary inconvenience, but as a condition your body is actively signaling about, giving you the opportunity to respond thoughtfully and protect your health. Always remember, noticing changes in your body is not overreacting. It is listening, and responding early with care can make the difference between a short-lived disruption and a serious health complication. So pay attention, act wisely, and support your body through these symptoms with attention, compassion, and timely care. When we talk about preventing diarrhea, it's important to understand that small, consistent actions in daily life can make a huge difference in protecting your health and keeping your digestive system balanced. One of the most effective ways to prevent diarrhea is through hygiene, especially hand washing, because many of the bacteria, viruses, and parasites that cause diarrhea are transmitted through contaminated hands, food, or surfaces. Washing your hands thoroughly with soap and water before meals, after using the bathroom, and after contact with potentially dirty surfaces is simple, yet it dramatically reduces your risk of infection. Food safety is equally crucial. Making sure that fruits, vegetables, and meat are properly cleaned, cooked, and stored at safe temperatures can prevent many of the pathogens that trigger diarrhea. Drinking clean, safe water is another foundational step because contaminated water is a leading cause of digestive infections, and using filtered or boiled water, especially when traveling or in areas with uncertain water quality, helps your body stay protected. Being mindful of what you eat also plays a role. Avoiding foods that your stomach is sensitive to, limiting excessive dairy if you are lactose intolerant, and being cautious with street food or unwashed produce can prevent irritation or infection that leads to diarrhea. Vaccinations can also provide protection against certain infectious causes, particularly in children or for people traveling to areas where diseases like cholera are common. Strengthening your immune system through balanced nutrition, sufficient hydration, regular sleep, and moderate exercise supports your body's natural defenses, making it less likely to succumb to infections or dietary disturbances. Awareness of risk situations, like eating at unfamiliar places, consuming raw or undercooked food, or exposure to people who are already sick, can also help you take preventive steps, such as carrying hand sanitizer, drinking bottled water, or choosing foods that are freshly cooked and hot. Maintaining good gut health by including probiotics or fiber-rich foods can further enhance your digestive system's resilience, helping it recover more easily from minor disturbances before they escalate into full-blown diarrhea. For families, teaching children about hygiene, safe eating, and the importance of washing hands can create habits that prevent illness and protect the whole household. Even during travel, taking simple precautions like avoiding ice and drinks from uncertain sources, peeling fruits, and being cautious with street food can prevent many episodes of diarrhea that would otherwise disrupt your trip and your health. Prevention is not just about avoiding discomfort, it is about protecting your body from dehydration, fatigue, and potential complications that can arise when diarrhea strikes unexpectedly. When you adopt these habits consistently, you are empowering yourself and your loved ones with practical tools to reduce risk, safeguard energy, and maintain strength. Remember, prevention is proactive care. Small actions each day, taken with awareness and intention, create a powerful shield for your digestive health. By paying attention to what you eat, how you handle food, your hygiene, and overall wellness, you can drastically reduce the likelihood of diarrhea and keep your body functioning at its best. Staying mindful, consistent, and prepared is not just about avoiding illness. It is about showing care for yourself and your family, ensuring that your days are lived with energy, confidence, and peace of mind. When it comes to treating diarrhea, the approach is focused on restoring balance in your body, replenishing lost fluids and nutrients, and addressing the underlying cause so that your digestive system can recover as quickly and safely as possible. The first and most important step is to prevent dehydration, because with diarrhea, your body loses water and essential salts faster than usual, which can lead to weakness, dizziness, and even more serious complications if not addressed promptly. Drinking oral rehydration solutions, clear broths, or water with added electrolytes is essential, and small, frequent sips are often better tolerated than large amounts at once, especially when the stomach is upset. Alongside hydration, dietary adjustments play a crucial role. Eating easily digestible foods like rice, bananas, toast, or boiled vegetables helps provide energy while being gentle on the intestines, while avoiding heavy, greasy, or highly spicy foods gives the digestive system a chance to heal. In cases where diarrhea is caused by an infection, your doctor may recommend specific medications, such as antibiotics for bacterial infections, though these are not used for viral causes, which usually resolve on their own with supportive care. Probiotics can also be beneficial, helping to restore the natural balance of good bacteria in your gut, which supports digestion and strengthens your body's ability to recover. Over-the-counter medications to reduce urgency or stool frequency can be helpful in some situations, but they must be used carefully and under guidance, because suppressing the body's natural expulsion process can sometimes delay recovery if the cause is infectious. Monitoring your symptoms is also critical. Keeping track of frequency, consistency, and any associated signs such as fever, blood, or severe pain helps determine whether medical attention is needed and ensures that the treatment approach is appropriate for your specific condition. Rest is another vital component because your body needs energy to fight infection, repair tissues, and regain normal function, and pushing through daily activities too quickly can prolong recovery or worsen fatigue. In children, elderly adults, or anyone with pre-existing health conditions, treatment often needs to be more carefully monitored as they are more vulnerable to rapid dehydration and other complications, making early intervention and consistent care even more important. Alongside immediate treatment, educating yourself about triggers, hygiene, and dietary practices supports faster healing and reduces the risk of recurrence. The key to treatment is a holistic approach that combines hydration, gentle nutrition, appropriate medications, rest, and careful monitoring, all guided by an understanding of your body's signals. Remember, recovery is not just about stopping the diarrhea, it's about restoring strength, confidence, and balance in your body so you can return to your daily life without fear or discomfort. By taking these steps thoughtfully, responding promptly, and paying attention to your body's needs, you are giving yourself the best chance for a full and safe recovery, showing care for yourself in the most practical and meaningful way. As we reach the end of our discussion on diarrhea, it is important to take a moment to reflect on the care, attention, and awareness that your body deserves, because even a condition that seems common or temporary is a message from your body asking to be heard, understood, and supported. Recovery from diarrhea is not always instant, but with gentle care, proper hydration, mindful eating, and rest, your body has an incredible ability to restore balance, regain strength, and return to normal function. And noticing the small improvements each day can be both reassuring and empowering. It's essential to remember that prevention and treatment are not separate from everyday life. They are woven into the habits, choices, and routines that protect your health and allow you to live confidently without fear of sudden discomfort. Taking the time to wash your hands, prepare food carefully, stay hydrated, and respond quickly when symptoms appear is a form of respect for your body, a way to acknowledge its signals and give it the support it needs to heal. For families, caring for children, elderly relatives, or anyone vulnerable means observing these same principles, ensuring that they receive fluids, nutrition, and attention promptly, and understanding that even small actions, like offering water frequently, encouraging rest, or monitoring symptoms, can make a profound difference in their recovery. Emotionally, it is also important to give yourself patience and compassion because experiencing diarrhea can be frustrating, exhausting, or even embarrassing, but it is not a sign of weakness. It is a natural response of the body working to protect itself and eliminate harmful agents. In this way, the end of an episode is more than just the absence of symptoms. It is a chance to reinforce good habits, to learn from what your body has communicated, and to cultivate a sense of vigilance and care that will benefit your overall health. The soft ending of this discussion is not meant to alarm, but to reassure, to remind you that with attention, awareness, and timely action, diarrhea can be managed safely and your body can recover fully. Embracing these lessons helps transform a challenging moment into an opportunity for growth, self-care, and understanding, reinforcing that your health is precious and worth nurturing every day. By being mindful of your body's needs, responding with care, and adopting practical habits, you are not only healing in the present, but also protecting yourself against future episodes, creating a foundation of wellness and resilience. And so, as we close this conversation, let this be a gentle reminder that your body communicates constantly, that listening, caring, and acting with attention are the best ways to honor your health, and that every step you take toward hydration, nutrition, and rest is a step toward strength, comfort, and confidence in your everyday life.